So before I also get started, I also just wanted to thank my mentor, Michelle, for all of her help and support and encouragement in this project. Like you said, I had a lot going on, and so it was helpful to have that, as well as my teammates on Team Elevation. So thank you very much. It made everything a lot easier to navigate. So as Arlene said, so I am a permanency specialist in Colorado. And so a lot of my focus is in regards to post-adoption and post-permanency in my day-to-day activities. So we have a newer program that provides post-permanency supports in our state. And so I wanted to look at this and see what it looked like through our family's eyes. So today we're going to talk about post-permanency services, supports, and the benefits that it has on our families here in Colorado. So what started this program as a whole in Colorado? So in 2016, the Child Protection Ombudsman launched an investigation that was completed in 2017 after there was a formal complaint from stakeholders that were alleging there was disparities statewide in adoption assistance monetary payments and inconsistencies in practices among our county human services department. So Colorado is one of those crazy weird states that's county administered and state supervised, and so practice really can vary across the 64 counties that we have here. So the goal of this investigation was really to examine the adoption assistance program in Colorado as a whole and the issues of delivering services statewide. So they identified three main areas of concern, which were families not getting clear guidance during their subsidy negotiation process, that families weren't really provided any kind of information on how their rates for financial assistance were determined, and then also that families weren't given really information or were given a lack of information on services that were covered after adoption happened. And so that's really where we're going to focus today. And so out of the investigation, the CPO had recommended that the Colorado Department of Human Services, so the Division of Child Welfare, complete a statewide inventory on the adoption-informed resources that we have here to identify obstacles and barriers that were really preventing families from obtaining any kind of adoption competent therapies or relevant treatment, study the rates that adopted children were being able to access services that were paid by Medicaid after their adoption finalized, and see what wasn't really being offered or paid for. So this was really to complete a plan to help connect families with post-adoption or post-permanency resources in every part of our state, not just in one area. And this plan really had to be reported to our Colorado General Assembly. And so when this plan was created, it really was to engage a multidisciplinary steering committee that was to develop and implement statewide a standardized approach to really address that post-permanency continuum and identify the needs of adoptive families and our children and youth in care. And so we really wanted to minimize what that reentry back into foster care looked like following adoption. And it was necessary to recreate really a consistent funding stream for this, a single point that family really had access to resources, have wraparound services for families and professionals that included a wide array of services, and also help families engaging these resources prior to them being in crisis mode, and really be more on that ongoing spectrum. So it was imperative to really employ like intentional targeted services for this population, because it really hadn't existed in our state specifically before. So once that initial program was established, it was to really identify regional locations across the state that could offer varying services. There's representatives from our adoption steering committee to participate with, our respite coalitions and really bring the adoption and kinship side to this conversation, and really identify, the needs for trauma-informed adoption, kinship, competent services, and to be accessible and affordable and reliable to everybody. So with all that said, we needed to look at a program that was successful and sustainable statewide and really provided post-adoption support at any time post-permanency, not just during the crisis. So first, we want to look at our reentry in Colorado. And so before we actually look at the program, let's see what this looks like kind of statewide. So over the past 10 years, on average, about 485 children re-entered the system per about 2,580 kids that are in care. So we know those numbers are not great, and Colorado has not done a great job with reentry. Our numbers have decreased in really both the amount of children in care and the number of reentry. And so over these 10 years, while the numbers have fluctuated, in our fiscal year of 2019, it was the lowest number of reentry. So although it is slow, we're hopefully moving in the right direction and continuing on that. So we understand that this is still a big point of need in our state, and is still a work in progress. So when we look specifically, so the prior slide was in regards to all reentry, so that was foster care included. This one is really talking about our reentry for adoption specific. So like we said, we know we have that high reentry rate, and now through our SACWA system, we're able to really identify the specifics if they're an adoptive or a relative guardianship case for that reentry. So for our calendar year, there was 4 re-entries for adoption, so 4 separate children and youth. Out of these, 3 of them were kinship placements, and 2 were actually one sibling group. And out of these 4, none of them really received post-permanency support. So the bottom 2, the 7-year-old and 6-year-old, really kind of re-entered out of kind of no fault of their own, not that any of this is a child's fault when they re-enter care. But 2 of them were for what we consider in Colorado beyond control of parent, which is really a child or youth who can't follow like their reasonable directions of their parents, are considered substantially out of control, can't really be controlled other than by a state agency, or their behavior really is a danger to themselves or to others. And then the other one was in regards to they had an assault. And so all of these, we know that there was a history of, behaviors, concerns that really needed some support. So in looking at my PICO, what I aim to look for in this project was if what we consider our post-permanency families, parenting the following types of children or youth. So what we consider biological families who'd reunified with their children or youth, kinship families who had guardianship of children and youth, or our finalized adoptive families receive post-permanency supports, which is also referred to here as PPSS, which are designed to be ongoing and not for crisis intervention only. Will families feel more prepared to be able to maintain children and youth in their home? So essentially, they're not going to return these children and youth back in our care. So I was really seeking to determine if these services really helped reduce reentry and are beneficial to our families who are no longer involved in child welfare. So why are these services important? So really kind of my literature review really indicated, families don't always feel prepared when their case closes. So often they've had a lot of services and supports in their ongoing case, and then all of a sudden, they reach some sort of permanency and everyone's gone. Which is kind of a double-edged sword because they've always wanted the system out of their life, but not wanting to have to meet with people and tell them every aspect of what's going on. But when they're gone, they're kind of just left in the dust. And so in Colorado, and I'm sure like every other state across the board, we're hoping that our youth and children don't come back into care. So we're really aiming to identify those that are at higher risk for not achieving permanency. And we use that through our predictive analytics program here, which really identifies our children and youth that are most at risk for emancipation. And we're really trying to identify and offer services that we haven't really had available to this population. So services can be for crisis or for ongoing. And one thing about this program that I find to be unique is it really allows for that biological parent the ability to engage in services. And one of the unique populations that we're seeing is Colorado is starting to look more for those kids who've been in care for long periods of time at the possibility of reinstatement of parental rights. And so we're really trying to pull in that population as well. The numbers aren't huge for it, but we want to be able to make sure we have a support system there. So when we talk about the PPSS program, so what is it? So Colorado has contracted with Raise the Future to be able to provide these services statewide. So we'll get into each service here specifically in a minute, but So this program was actually phased in our state over 3 years in varying parts of the state. So meaning our rural areas were in our first 2 phases, and then the metro area was actually last, and that was really done on purpose. So we did this because there's always been, for us, a lack of services in our rural areas. They generally have to go farther. They don't have access to a lot of different things. And so we felt that it was much, I don't want to say easier, but a little bit better to start there. And the metro area had a lot more that they could utilize in the meantime. So overall, this program is actually still very new and kind of in its infancy stages. But the services here that are provided are TBRI, which is trust-based relational intervention, personalized in-home coaching, implementation and connection groups, respite, professional consultations, resource coordination, searchable database, specialized training, and staff opportunities. So what is TBRI? So I'm sure a lot of you are familiar with this, but essentially this is the backbone of our program. So it's evidence-based and is actually currently listed on the California's clearinghouse for the Child Welfare Registry. And families generally need to complete the TBRI training series prior to accessing most parts of this program. So this is focused on connecting, empowering, and correcting principles. So what this is really an evidence parenting and intervention model that was developed by Dr. Karen Purvis and Dr. David Cross at Texas Christian University. And so it's really a family-based intervention for children and youth who've experienced relationship-based traumas, institutionalism, multiple placements, maltreatment, abuse and neglect, and is really built on a neuropsychological theory of research. So kind of put in simple terms, it's really designed to meet the high and complex needs of our children and youth who have experienced harm and stress and various trauma, and is really based on that attachment, sensory processing and research, and really is meant to be done on a child by child or youth by youth basis. So unfortunately, we can't really go into TBRI as a whole because that's a whole in-depth thing on its own, but we can talk more about the other areas. So personalized in-home coaching. So once a family has completed the TBRI series, they can access the in-home coaching portion of this program. So this is really family-based intervention designed for children and youth who have these traumas that we've talked about, those multiple placements, maltreatment, and provides hands-on guidance by an actual TBRI practitioner in their own home, and being able to implement some of those skills and strategies effectively. So they're able to access those services quickly, and again, they're in their own home, and really they're able to dig into what's going on specifically to that family, that child, and it focuses on the family as a whole and not necessarily, you know, the child and their kind of quote unquote problem that is causing the stressors in the home. The TBRI practitioners actually have to take a specific training that's done by TCU, so not anybody really can just go and say, hey, I'm going to be a practitioner. So that's also very specific. Connection groups. So connection groups are, and I hate referring to it as a support group, but that's kind of more along the lines of what it's geared towards. So the goal of it is really to ensure ongoing support, training, group coaching, networking for families. And a practitioner also facilitates these monthly groups in each region. So these are not specific, like this is a training, we're going to sit through this. It's really more about them connecting and talking with each other, and how the practitioners run it is really they actually have like a dinner, and really people sit down. There's a kid's side, there's an adult side, and it's actually really been successful, specifically in our northeastern part of the state. So respite. So I'm sure we've all heard of respite. So they like to call it in this program the rest and recharge, just to kind of try to give it a little bit more positivity. And so it's allowed to provide up to 6 hours a week for families who are using that in-home coaching and live in a service area that is provided by that practitioner in the program. So respite is not currently available in all counties. The counties that are not included are our metro counties. So right now that's basically due to them kind of having some resources as well as some budgetary concerns that we had. And we also felt that the metro really had more access to this as a whole. And it actually isn't used as often in the metro area as you would think. What are implementation and connection groups? Sorry. So the goal of these groups are really to, again, have that ongoing support. They're not really, again, training sessions. So professional consultations. So what are these? So these are a little interesting as well. So these are monthly calls that they hold with the TBRI practitioner that are generally virtual, and they can provide kind of hands-on guidance to professionals in the case. So whether it's the caseworker, they're trying to identify challenges related to case plan goals, improve their staff's ability to recognize trauma in their work, and being able to connect them with the right services as well. And caseworkers also can call in and staff kind of any difficult cases that they're having to really get further insight. One of the pieces with this is those workers do have to have done TBRI training. So what is resource coordination? So families are connected by someone in the program to something specific that they're needing, or additional community resources, services statewide. So there's a searchable database that really kind of can include things like mental health, special education, child development, and it's also searchable by topic and location, which has been a lot more helpful than things in the past. And then also that what kind of coincides with this is the resource database. So this is a statewide database that's really for families to be able to kind of do things themselves. They also have the ability to search by relevant topic. It's also more relevant to their needs if they're specifically looking for kinship related services or reunified related services. They're able to view this on their own. And we also have something, it's called the resource lending library. So they can check out items. Like for example, they want to try out a weighted vest before they go and purchase one. It's something that they can utilize. Specialized training. So these are trainings for families and professionals that can be done web-based or in person, kind of varying on where we're at in the state. Training really, again, is related to permanency, trauma, attachment, just to name a few. And like, for example, a recent interesting training they had was a biological father who was reunited and really shared his experience and insight. So they're basically additional training to support the work that's really already been completed. And we also have staff training opportunities, which is pretty much what it sounds like. A variety of classes for professionals to choose from and be able to provide support. Okay, so let's talk more about the program. So who can participate? So biological families who've reunified with their child or youth. So this can be closed cases where the child remained home, or even reinstatement of parental rights have occurred. Kinship families who have guardianship of the child or youth in their care, and finalized adoptive families. So the biggest parameter around this program is that you can't have an open case with DHS. So it's now available in all 64 counties in Colorado, both rural and metro. And we do get a lot of counties asking for the ability to use this program with open cases, but it's just at this point, that's not something that's allowed, and a lot of that is due to our funding. And so this again brings me back to my PICO. So again, I'm asking if, these post-permanency families receive post-permanency services, which are designed to be ongoing and not for crisis intervention. Will families feel better prepared to maintain children and youth in their home? So what I did is I sent a confidential survey to try to find out how families really felt about the program and its effectiveness. So I really wanted to get their voice and see what they were saying. So this survey really had questions and also allowed for written feedback to be provided. So this survey was sent to 278 families who had either previously or were currently receiving services. And it was sent really to learn their progress, their success, and challenges in the program. So we'll get into the survey in a second, but the areas that were covered were demographics, why they were seeking services, benefits that they saw receiving services, challenges, the satisfaction and effectiveness, suggestions they had for improvement, and then the big question, did they feel prepared? All right, so let's look at the survey. So of those that responded, I had a 19% success rate, which I was hoping for a stronger response rate, but I know that, sending surveys can be very difficult. But I think that I still was able to get a lot of great insight from those who did complete it. So Out of that 19%, 59% of them were kinship families, 38% were foster families, and then the remaining 1% was reunited biological families. So if we're looking at this by region, so how we have this program broken down, it's by 7 regions across the state. So it's our metro, our mountain, our northeast, our southern, our southeast, our southwest, and our western slope. Our metro is, our biggest, and so that also is our biggest participant at this time. But like I said, our northeast region is really has benefited a lot from this program, and it's also our next large participation. So I also asked how long they'd been with the program. So this was either less than 6 months, 6 months to a year, or more than a year. And 40% were more than a year. A lot of the less than 6 months have been those in that metro area. I also asked the race of families. And so this was how they had self-identified themselves. So we had the largest population that we have is white, which is 67%, and then other, which was 57%. There was no Native Hawaiian, Pacific Islander. Our Black or African American population was 23%, Asian was 9.6%, and then the same with American Indian or Alaska Native. So if we look at the ages, I asked about who was in their home. So these are families, they could have multiple age groups in the home, so that's why the numbers don't look a little odd. So our biggest population is at 9 to 12. And so that's at 76%. So this is often that huge age group that lingers in our system, comes back into our system, doesn't find permanency for long periods of time. So it's great to see that huge population is being served along with our teen population, because again, that's generally who remains in our care. So if we look at the service participation, so again, everybody needs to generally do the TBRI training to access the other services. And the other big piece that is received is the in-home coaching. I talked about those connection groups, and those have been really popular, like I said, in one of our regions, but then it's not so popular in another. COVID has really kind of played a part in this, just because things were in person, they've been virtual. One region really has liked the virtual piece and then doesn't want to go back to in person when that's an option. So really each region has had to kind of vary what they're doing based on the needs of the families in their areas. And the professional consultation shows a 0, and this is likely because when those that responded were not, there were professionals who were not adoptive, guardianship, or biological family. So it's not that this service isn't being utilized, it just wasn't responded to in this part of the survey. So I asked about satisfaction with the program. So overall, families were very satisfied with this program, either satisfied or very satisfied. So only about 15% really were either neutral or dissatisfied. Some of those responses also have been those who are newer to the program. They really said that they couldn't really kind of have an opinion one way or the other. And so they were kind of just stuck in that middle part. The effectiveness of the program. So again, like the satisfied, we wanted to see why they felt that it was effective. And so again, most families really felt that it was either effective or very effective, with, only about, say, 20% feeling that they were too new and not feeling that this program was helpful at all. So I also asked why families chose to participate. So I know just working in this field, reasons that I would see and why they would participate, but I really wanted to hear their words. So kind of the responses that I got was there's a lack of service in their area, lack of support. They provided in-home care that has ended. They were able to connect with other families. They could learn those skills, and there was no cost to them for this program. So the benefits of working with this program. So families, again, from them directly, they felt that services were being able to be provided in their own home, which for some of our larger families or some of our families that have huge challenges with their children, not having to pick up everybody and go somewhere was helpful. Again, there was no cost. It was tailored to their own child. The whole family was involved. They could connect with someone quickly. And then they also, again, were able to form those connections with others. So some of the challenges, a lot of the challenges really were reported to be the same. So a lot of it was like implementing new skills, and challenges is hard. I mean, nobody likes change. And so being asked to try something and then also, trying something and, not succeeding, that can be very frustrating. They also felt the behaviors were hard to change when you don't see the progress. And people want to see progress right away. And so sometimes that's difficult. And then some tools really just didn't work for each situation. So when I asked about improvements to the program, I also thought this was interesting because there was nothing specific that was like, oh, I would change, I hate these connection groups or anything like that. It was very specific. So they wanted just more coaches just to kind of get a different voice. They wanted just more support groups because although there wasn't one in the region, they're still spread out. And so families do have to travel for that portion. And then they wanted to have some sort of like an outing to kind of really put some of those skills to work, but also still have that presence of their support network that they found. And then also being able to do a refresher training. So when they did that initial training, a lot of the time, like all of us, it's like, oh, I can't remember what happened in this. So they wanted to look at that. So overall, after participation, did families feel better maintained to keep their children in their home? So overwhelmingly, this was 84% said yes. So for me, I thought this was huge. This shows really that need for those services, even when cases close. Families are often ready, like I said, to get rid of us, but they still need that support in some way. So families also reported just feeling more confident, more supported. They weren't living in crisis mode all the time. They had a better understanding of their child and youth and really looked at their own parenting versus, what the child's issue was. And they didn't really, this was an interesting question, is they really didn't see their child at risk for out-of-home placement. And I'm wondering if that was really, they felt afraid to say like, oh yes, I would return my child or my youth to your system if this happened. There was not one response that said that their child was at risk for being out of home. So next steps. So for me, this was really promising to see, and that families are really utilizing supports and find them to be helpful. So often they can find resources and support, but it's not really the best or the most useful to their situation. And again, we're still at the beginning stages of this. And so, it's great to see that there are those big benefits and impacts. And I think now, actually, after listening to some of my fellow fellows, like Sharon Lynn said earlier, listening to their projects will really start to give me some more ideas to consider of some next steps. So we also at my office will continue to work with Raise the Future and discuss really what this program is looking like, benefits, challenges, and kind of see where it takes us. TBRI was recently reviewed and on Prevention Services Clearinghouse, which is also promising. And we'll also continue to monitor our reentry rates and looking at the potential of adding this as a prevention service, because families can also use this on the front end. And I just hope that we can get there someday. I hope. So the impact of this project. So I think when I started this, I knew that this program would really have some benefits. I just didn't realize how impactful it would really be. And to see our families across the board in, receiving these services in varying age groups, locations, service array. So really for me, it's helped me see that we still have a lot to do, and that's not a surprise, but we have a great start. And so that makes me hopeful. It's also really to show that valid need for these services to exist and to be accessible to all of our families. And again, like I said, what I gathered, I'll share with our partner at Raise the Future to help just improve that quality of services and include that family's voice. And as I mentioned earlier, just hoping to expand at some point, being able to add this to all families. So the impact of this program as a whole. So this program has been useful to me in a lot of ways, and it's actually taught me a lot more than I really thought would happen. So I think it helped me to learn that being a leader allows for growth, and there's always room for improvement there. I've really learned to ask the right questions and get the valid information that I'm looking for. And so I also learned that it's okay to challenge the process that's going on and at least raise questions. So I've never really been afraid to ask questions, but I think I feel more confident now in being able to do so and being more of an advocate. And it's also taught me the value and importance of data as a whole and how to interpret it. So I don't know if you're like me, but one of the reasons I came into social work is because I couldn't math. And so my grad school stats class was the worst thing that I ever had to do. So being able now to find that it was useful and really helped me learn more about it, it doesn't give me as much anxiety. I don't think it's so bad, and it really gave me that appreciation. So, and I think the last thing that I found the most beneficial was really learning from my peers and being able to form those relationships with my team and other leaders across the country, along with, the knowledge of Arlene and Sherilyn in this. I know I can reach out now just across the country to say hi or say, hey, I'm having some issues. What did you do here? I saw in your project you did this. So really just being able to be a part of this program has been a great opportunity. And so I thank everybody.